Hey guys, Dr. Childs here. This video is going to be on Victoza dosing and titration guide. So basically, how to use Victoza, what kind of dosages you want to be using, how to titrate it, when is right to use it, etc. So let's jump right in here. So first of all, do you need it? That's always the question we want to answer first. Now a little backstory on Victoza here. Victoza is a medication which falls in the class of GLP-1 agonist, which stands for glucagon-like peptide 1 agonist. And GLP-1 is just a receptor. Okay, so the way that this medication works is it sits on this receptor, blocks it, and then it has a bunch of beneficial effects as a result of what it does to this receptor. Okay, so the question is, do you need it? And the truth is, so let me give you another quick little backstory here. So Victoza was originally FDA approved for type 2 diabetes because they found that it lowered insulin. Now what they did is when they started giving it to diabetics, they realized that all of these diabetics were losing a bunch of weight. In fact, this has been the best medication that has ever existed in terms of its effects on weight loss, but it was never FDA approved for that purpose. So the makers of Victoza thought to themselves, well, we can make a lot more money if we use the same medication but just call it a different name and then get it FDA approved for weight loss. That's exactly what they did. Okay, so this medication is FDA approved for type 2 diabetes and for weight loss, but it has two different names. So Victoza is the one that's used for type 2 diabetes, and Saxenda is the one that's FDA approved for the treatment of obesity or weight loss, and that's because it's seriously just that effective. Now the problem is, and this is why we need to talk about this for a second, is Saxenda. So the company obviously did this to make money, and the pharmaceutical company, and they don't. The FDA insurance doesn't really approve medications for use of weight loss, so it's basically all cash. And Saxenda costs about $2,000 a month. So it was kind of just a money grab, even though this medication really works that well. So the reason I talk about Victoza and not Saxenda is not because they're different. They're actually the same medication, which is liraglutide. But what you want to understand here is getting Victoza is way easier than getting Saxenda, because Victoza, there are a couple things that you can do to get insurance to cover it, which means it's not going to cost you $2,000 a month. Okay, so you get all the benefits without having the cost. That's the whole reason for me going into that backstory here, just so you know what we're talking about here. So the question is, so let's go back to what we were talking about before. Do you need it? So first of all, it works for pretty much all people who are interested in weight loss. And the reason it does that is because it lowers glucagon. And glucagon is one of these things that's underappreciated in terms of what it does for weight gain. So glucagon is what increases blood sugar and prevents, with high blood sugar, it prevents your body's ability to burn fat along with insulin. So it lowers glucagon. It also reverses and lowers insulin, and it treats leptin. So this one medication is treating 3 of the big 4 in terms of hormone imbalances that cause weight loss. The only thing it doesn't do is directly affect thyroid hormone, but that's, I mean, when you get all these benefits, that's okay, right? You can just add thyroid hormone to it and get a ton of benefit there. So the reason it works so much is it lowers glucagon, lowers insulin, lowers leptin. So pretty much anybody who has all those things, leptin resistance, insulin resistance, or hyperglucagonemia, which is a term that will become more popular over time because it's a newer thing. So don't worry about that too much. Just know that it treats basically all the causes of weight loss it's going to treat. The other thing is that it's actually particularly helpful, and this is something that I found, in helping people repair their metabolism. And this is a big deal because there's only a handful of medications, LDN potentially being one, fasting being another therapy, and then also Victoza potentially being one. So there's really only 2 to 3 therapies that actually heal a damaged metabolism. This is one of them, so it's huge. Another group of people that tend to benefit from this would be patients with PCOS, or who fall on that PCOS spectrum. The reason is because it lowers insulin, but it also seems to have some effect on androgens, meaning that it lowers testosterone if it's too high. If you have a normal testosterone level, it's not going to lower it. It normalizes the testosterone, is a better way to put that. But has a tremendous effect on insulin. So really, anybody who wants to lose weight, who wants to get a boost, should at least consider Victoza. And the beauty about it is, we use it in a temporary fashion. I'm going to talk to you about how I use it. But this is not something you have to get on and stay on forever, because if you follow all of the things, all of the recommendations and the therapies within my guide, you hopefully you understand that when the weight comes off, it comes off because we've reversed the hormone imbalance. Now, yes, we do use things like medications like Victoza to augment that reversal process, but it does not mean that you need to continue on Victoza long term. In fact, the opposite is true. We reverse the hormones, they stay that way. We have you continue Victoza for a little while once you've reached your target weight loss goal, and then we take it away. So that's really the way that we want to be looking at this, okay? So let's move on to the next one here, which is titrating Victoza and starting dose. Basically what this means is what is your dose that you start with, how do you go up, and et cetera, et cetera. Now, a lot of people really mess this up, and I mean, people is probably the wrong choice of word here. It's mostly physicians. But this is something that is probably not prescribed that much yet. I suspect in the next 5 to 10 years, once people are kind of catching on to what I'm talking about here, it's going to be too good not to be prescribed out like crazy. But you're going to have a head start on all this stuff, and you'll understand exactly how I use it because I spent a lot of time figuring out exactly how to do this. So what do you start with? So really, Victoza, which again is different from Saxenda. Now, Victoza, the dosages on Victoza range from 0.6 milligrams to 1.8 milligrams. So you basically have 3 tiers of dosing: 0.6, 1.2, and 1.8. Now, Saxenda is actually at a 3.0 milligram dose, which means it's higher than Victoza can ever get, and we'll talk to you about how to actually get up to that high dose using Victoza. So again, it's covered by insurance. But the point is, if you are, so where do you start? So the point is, if you're a sensitive patient, and again, you guys know who you are, generally, if you're concerned, it doesn't hurt you to start out in the sensitive range and then go up to the normal patient kind of dosing and titration. So this is not a big deal in terms of where you should start. Just realize if you're really sensitive, you might want to start at the 0.6 milligram dose and then just simply stay there, okay? And the reason for this is, now, because Victoza has some side effects, and we actually want you to experience some side effects on this medication because it's an indication that it's working. Now, what happens sometimes is people, they start at their dose is too high, or they don't know how to titrate, and they get, or better yet, or worse yet, I should say, their physician doesn't really explain to them what to expect. So when they start to feel the nausea, like, this medication doesn't work for me. No, it will go away, and that's okay. It's just you have to know you have to know what to expect and what to anticipate, so you don't prematurely go off of it. So for sensitive patients, start off at the lowest possible dose, which is 0.6 milligrams. Monitor your body for weight loss and stay there until you reach a plateau. Remember, this is unique to Victoza and all GLP-1 agonists, but the titration, meaning how much you use, should never be based off of symptoms alone. It should always be based off of weight loss. The reason for that is you do not want to go up prematurely on Victoza unless you absolutely have to, because it's kind of like your trump card. Okay, so don't just go up arbitrarily. Only go up if you've reached a weight loss plateau, and I'll define that below. Okay. Now, what if you're a normal patient? A normal patient is someone who should start off with the 0.6 milligram dose, same as a sensitive patient. The only difference is after 7 days or 7 injections of using Victoza, you then want to increase up to the 1.2 milligram per day dose. Okay, so you're basically doubling your dose up to 1.2 after 7 days, and you're staying there. Now, you want to stay there. And again, do not go up further from the 1.2 yet. Do that only if you've reached a plateau. Now, what do I mean by a plateau? A plateau, by my definition, is somebody who is doing everything that we're talking about in this program. So in my weight loss program. So that's you're doing the fasting, you're doing the dietary changes, you're eating clean, you're exercising, you're reducing your stress, you're taking your supplements, you're doing every single one of those things, and your weight is not dropping even though you've done this all for 3 weeks. That 3 week period is defined. That's what the weight loss plateau is. Okay. Now, if that occurs in your body, then it's the time to increase your Victoza dose. Okay, then and only then. Now, what you'll find too, just so you guys know, you're probably going to run into, I don't know, maybe 2 or 3 plateaus in terms of how much you lose over time. That's perfectly normal. I will do a video on how to break through those plateaus, but this is one of those things. One of the ways you get through it is by increasing your Victoza dosing. But you do not want to, the important thing here is do not increase your dose prematurely, because then you can't fall back on that increasing of the dose if you do run into the plateau, right? So that's why this is important. Now, the other thing to consider is the maximum dose that you want to use with Victoza is the 3.0 milligrams. But again, that is higher than what Victoza technically goes to, because the 3.0 milligram dose is the Saxenda dose, but you can kind of get away with that. And I will talk about that a little bit later. Okay, so that's how you dose it. Now, how do you know if you're getting enough? How do you know if you're getting too much? What symptoms to look out for? Okay, so let's boil it down, and this is how it works. You want to be getting a little bit of nausea when taking this medication. Okay, you want a little bit, and you're not going to like me for saying that, but what that means is it's an indication that it is working. And that's an indication that it's sitting on the receptors. It's going to help you with weight loss. So you want a little bit of nausea. Now, how much is too much? You should not be vomiting, and you should not have extreme nausea to the point where it's limiting your ability to do your day-to-day activities. Okay. Now, yes, when you go up initially, you might have like 1 or 2 days, which are pretty bad. But for the most part, you should be able to tolerate, break through that 1 to 2 days and kind of just feel a little queasy, but not too much. And you might say, well, I don't want to feel queasy. Well, trust me, it'll probably be worth it. It's okay to have a little bit of queasiness, I think, for most people, and then to lose 50 pounds over the next, I don't know, 5 to 6 months or whatever. Most people would make that trade, but that's up to you, right? I'm not going to tell you have to do that. I just want you to be aware of this because it's important to indicate that it is working. So when do you stop your titration, or when do you slow down your dose? If you're getting the nausea that I talked about to the point where it's causing you to vomit, that's not normal. That you want to stop your dose if it's doing that, because you do not want to get dehydrated or anything like that. And then the other thing is, occasionally patients have some weird symptoms. For instance, I had one patient who had back pain, very abnormal, happened one time, but you want to watch out for just weird symptoms like that you can't attribute to anything else. So just watch for those strange symptoms, and if those occur, then you might want to back down on the dose. So what happens if, let's say, you start at 0.6 milligram dose and you're a normal, quote-unquote normal patient, so you want to go up to the 1.2 milligram dosing after 7 days of using the 0.6. So you go up to the 1.2 milligram dose, and then you're hit with a lot of nausea. You may be, you vomit that day. What then do you do? Okay, first of all, give it at least 1 day. All right, so give it 1 day. If it happens the second day, then it's very simple. Back down to that 0.6 milligram dose. Why? Because that's probably all you need. Okay, and so that's the way that you kind of want to think about this. Just having one day of vomiting or something like that doesn't necessarily mean that you need to stop the medication or stop the titration. It may instead mean you just need to slow it down, reevaluate how quickly you're going up, and go from there. Okay, so remember these things in your back of your head. If at all possible, you want to stay on it, but favor using a lower dose than a higher dose. Everyone is different. I have some people who take the 0.6 and they don't feel anything all the way up until 1.8, and then some people who start, at 1.2 is good for them throughout their entire weight loss journey. It really just depends. So you have to watch out for that thing. Again, I'll reiterate here, but only increase your dose when you've hit the weight loss plateau. Do not increase, except for the normal patients, when you go from 0.6 to 1.2. That's the only time you want to increase the dose outside of a weight loss plateau. And then the other thing is, you will want to continue your Victoza or GLP-1 agonist, whichever one you get on. And I'll make videos on all of these just in case you can't get Victoza. You want to continue using this medication for about 3 to 4 months after you reach your target weight loss goal. So let's say your goal is to lose 30 pounds, just arbitrarily just pick 30 pounds. So you're 150 pounds and you want to get down to 120. So let's say you get down to 120, it takes you, 6 months or whatever. You're going to want to continue the Victoza for 3 to 4 months after you hit your target weight loss goal, and then stop it. Now, the reason is because we want to reset that body set point in your brain. We want to re-educate your body that the new weight that you're going to be on is 120. Now, sometimes what will happen is you'll go off the medication, you may gain like 2 or 3 pounds. That's not a big deal, and it's not going to be like once you go off of it, you're going to go from 120 back up to 140. It's not going to be, or 150. It's not going to work like that, but we want to make sure we keep it there, we equilibrate the body, and kind of retrain your body what your new weight is, and there's an indication, there's a reason for that. Okay, so that's how you do the titration, and that's how you monitor your symptoms. The next thing is labs. This shouldn't say labs on T3. It should just say labs. So, do you need to be checking your labs as you go? You don't, believe it or not, you don't really have to, and the reason I say that is because your leptin levels, which is, some people tend to perseverate on labs because they just like to look at them, and that's fine. But the problem with leptin is that leptin, just like insulin actually, is that these hormones change, on an hourly basis. Okay, and so if you order one leptin level, and let's say your initial fasting leptin level is 30, okay, you've got leptin resistance, period. Then let's say you lose 15 pounds, you start Victoza, you recheck your leptin level, and it's 32. Does that mean you're doing something wrong? No, not at all. That's just the flux and change in the hormone levels, right? We know it's a good thing because you're losing a bunch of that weight. Now, what I'll tell you too is leptin tends to be a little bit volatile during treatment, and then it steadies out after you're done losing your weight. So just to remember all that, that's fine. The other thing is leptin will naturally go up when you lose weight. So that's normal. In fact, the reason that most people gain weight is because that leptin stays up for too long, but because you're using GLP-1 agonist or Victoza, that's going to negate that rise in leptin, and it will help you. So if you want to, you can check your leptin and you check your insulin, but it's not like you base your dose off of that. You base your dose off of your weight loss plateau and the symptoms that we have discussed. Now, yeah, I already talked about the leptin making it spike. And then here's the other thing that's actually important and worth mentioning here. Now, this is unrelated necessarily to what leptin does, or I'm sorry, to what the GLP-1 agonist or Victoza does, but as you lose weight, what you might find is your body is now more sensitive to the thyroid hormone that's already circulating. So you actually might have to lower that dose. So I mentioned here, just keep an eye on your thyroid function as you go, because you're not the same person you were when you're 20 pounds lighter, 30 pounds lighter, 40 pounds lighter. So this actually happens a fair amount in my patients. Once they start losing this significant amount of weight, their biochemistry changes and the amount of hormone that they need changes, etc. So just keep an eye on all this stuff. Realize that things changes as you lose weight. Okay, here's a big one, and one we want to spend a little bit of time on here. So Victoza is expensive, so we need to talk about the price, and we need to talk about ways to actually get Victoza cheaper. And this is the culmination of a lot of struggle on my part to try and make this affordable for my patients. And so one of the biggest complaints is that most doctors won't do any of this stuff. So it's going to be up to you to kind of put forth this effort, because number one, you're going to want to use it for all the reasons that we just talked about, and number two, you're not going to want to pay thousands of dollars per month, which is what the pharmaceutical company wants you to pay. But you have to realize they've got their patent on these medications for, I don't know, 10, 15 years, some inordinate amount of time. So it's not worth waiting 10 to 15 years for it to be generic before you can use it. That would just be silly, because by then there's going to be good stuff out anyway. So use these strategies to try and get your Victoza for cheaper. Now, these are specific to Victoza, but they will also potentially work with other GLP-1 agonists. So first of all, yes, we talked about it. It is expensive. Insurance doesn't like to cover it. They just don't like to spend money on you. Even if, and this is ridiculous, but let's say you could lose 50 pounds. It's way better to spend a couple $1,000s on you from your insurance perspective to help you lose 50 pounds and pay a little bit of extra on the Victoza than it is to have the risk of whatever risk would be associated with being overweight for that period of time. So you can imagine, when you're 50 pounds overweight, you're going to have an increased risk of stroke, of heart attack, of metabolic syndrome, of all of these things, cancer even. And so if you can eliminate that risk, you're going to save tons of money down the road. So I even do have some patients who will fork over the money anyway. The reason for that is because they understand this cost analysis. It's better for you to lose 50 pounds or even 30 to 50 pounds now, because that's going to save you money long term, because you will be on medications if you remain that 50 pounds overweight for several decades over time. So put that in the back of your head. Now, the first thing you want to have your doctor prescribe it, ask for it, they'll prescribe it, and then what'll probably happen is one of two things. They'll either cover it, which is great, or they will tell you need a prior authorization. If that happens, what you want to do is you want to call your insurance and you want to ask which GLP-1 agonist they like or prefer. Now, you'll want to include, I'll do another video on this, but you can get a list of all these GLP-1 agonists. So they would be Victoza, it would be Byetta, it would be Bydureon, and it would be Trulicity. And then the other one that you can ask for is Symlin. These all work very similar ways, but Victoza is in my opinion the best. That's why I talk about it. That's why I've done this video on it first. But I will do videos on the other ones just in case your insurance doesn't cover it. So ask your insurance. Say, which one do you prefer? Occasionally what they will do is they'll say, well, we don't cover Victoza, but we will cover Bydureon. So then just have your doctor prescribe Bydureon and go from there, right? Unless you really, really, really want to use Victoza, in which case you can use these other things. So that's option number one. Ask the insurance which one they want, and then simply have your doctor prescribe the new one. Boom, done, right? The second thing you can try is, if that doesn't work, you just simply do this. Google Victoza coupon code. The first thing that pops up is a coupon code that will promise to knock the price down to $25 per month. Okay, now this works sometimes and sometimes it doesn't. It has about a 50% chance of working. When it does work, people love it because you're guaranteed the Victoza for 2 years at $25 per month, which is awesome. You'll get all the results we just talked about and you won't ever have to worry about it again, and you'll maybe have spent a couple $100. Boom, done. Now, but 50% of the time it won't work, and I've gone through this a bunch of times with patients. I don't know why it does and sometimes works and why it doesn't. I really have no idea. I'm just telling you it's an option. So Google Victoza coupon code, click it. I think you sign up for it. They mail it to you. You take it to your pharmacy, and then they do that. Okay. So the third step is, if that doesn't work, you use something called covermymeds.com. What you'll do is you'll have. So let's say you send in the prescription for the Victoza, your doctor does, and then they say, no, we need a prior authorization. Almost every time you do a prior authorization, it will likely fail. The reason for that is Victoza is FDA approved for type 2 diabetes, not for weight loss. Saxenda is the one that's FDA approved for weight loss, but no insurance will cover it because it's $2,000 a month. So you have to be a little bit tricky here. You have to try and do the prior authorization, but I recommend using the program covermymeds.com. Now you'll have to have the pharmacy initiate that prior authorization key, which will then be emailed to your doctor, and he or she can fill that out. The reason I recommend that is because that's the highest, or it carries with it the highest likelihood of being covered by insurance if you do it that way. Because otherwise what will happen is they'll have to send over your medical records, and then they'll say, well, this person doesn't have type 2 diabetes, unless of course you do, which you don't necessarily have to, but you might. If you do, then you're good, but if you don't, then you're in trouble. So that's why we use covermymeds.com. Then the last option is, and I have patients who have done all these things, is you can consider purchasing it from a Canadian pharmacy with the prescription from your doctor. All you do is you have them give you the prescription, like hand it to you, and then you can fax it to the Canadian pharmacy or whatever. They have cash prices, which is always cheaper than the U.S., believe it or not. And it's actually real product. It actually works. These are legitimate pharmacies just over there. So that's the last thing you can try. And then actually this isn't the last thing. Then the absolute last thing you can try if none of these things work is you can say, okay, call your insurance, ask your insurance, because usually Victoza is tier 3, meaning you have to have failed the first 2 lines of therapy before you get to it, but you don't want to use those other 2 lines of therapy because they simply don't work. But what you can do is you can kind of trick the system. You can say, okay, physician, he or she, order metformin and usually a glipizide, and then all you have to do as the patient is pick it up once. Pick it up for 1 month. You don't have to necessarily take it. In fact, I generally don't recommend that you do, but pick it up so that there's record that you did get it. And then that, like 3 months or 2 months later, you can have your doctor resend it over, and that's usually enough to get them to prescribe it, no questions asked. So there's a bunch of steps and a bunch of tricks to getting this. So what you might find is this is going to be the hardest thing to get it cheap, because otherwise they're going to try and charge you an arm and a leg for it. So use these tips to try and get it for cheaper. And then lastly, can Victoza be used, like how else should you be using it? So first of all, it's a daily thing, and for best results, you're going to want to use it with other therapies. You're going to want to layer the therapies that I talk about here. So yes, it can be used with T3 and natural desiccated thyroid or levothyroxine. It can be used with all thyroid medications. It can be used with all other hormones, and it can be combined with metformin safely, but it should not be combined with insulin unless you have a doctor who's really watching you. So the other thing is it can be combined safely with supplements. It can and should be used on your fasting days, can be used with dietary changes, can be used with thyroid and other hormones including progesterone and testosterone, etc. So this doesn't change anything necessarily, just using the medication. Instead, it's more about a complementary type of therapy which helps you with everything else that you've got. Okay? So that's really what I wanted to say. Now, special medications like metformin should be considered just, again, temporarily, because there's a boosted effect. So it's like, it's not 1 + 1 = 2 type of thing. It's like 1 + 1 = 6, right? It's like a multiplicative effect type of deal. I know that's not exact, but just forget what I said. The point is, it boosts the existing results of whatever medication you're using, and it works on fasting and should be used on your fasting days as well. Okay, so that was a lot of information, but that is basically in a nutshell the information that you need on using Victoza, how to titrate it, and everything. Now, this information is really valuable. I don't know of I've created this information and through practice or trial and error and practice on patients, and I know that it works really, really well. So just consider all this stuff. And if you have any questions, let me know. But otherwise, this is the end of this video. So there'll be another video coming out on the other GLP-1 agonists. So just watch out for those.